Okay, so we're getting a good look here at the tear now. This is the tear. As we lift up and look to the left, there's the biceps tendon underneath. There's the articular margin. This is the lateral aspect of the footprint, and here's the hole. So I think we're ready to start planning our repair, which we do by taking a spinal needle and that looks like it's going to be a pretty good shot there. I'm just trying to judge how many anchors we think it's going to be. It looks like if we can get this down something like that, that'll be a good place. Okay, here you can see we've got our sutures in. I'm tugging on the anchor to make sure it's seated. And you can see I can pull the entire humeral head just by pulling on those sutures, so it's very strong. And now in order to get our implant in, we're going to take the crochet hook and take some sutures out right here. Okay, we'll show you some more in just a minute. Okay, here you can see how we start to tuck the patch down. The patch sits above the bone underneath the tendon. So the bone is underneath, under there. We've got the patch tucked all the way up to the articular margin there. I like the way that looks. This is the posterior leaf of the cuff. We're going to bring this way over here like that. And we've got a little bit of a dog ear there, but we're going to take care of that in just a second. So I'm happy with the way the patch is laying. We'll show you some more in a minute. Okay, so here we're going to take our suturing device. It's loaded with a black wire called a super shuttle. You can see it coming out of the tip there. And we like to see exactly where the tip's going to come out first. Hold right there. So we'll take that bite there. Okay, so we've tied one of the sutures. This is the most posterior suture. There's the knot right there. And you can see how that's really snugged down the tendon to the bone right on top of the rotium. That looks really good. We're going to tie this blue and white one next. Once we pass it, we're going to use a suture hook to make a stitch right about here. Okay, so we've passed but not yet tied this set of sutures. They're going to sit just about like that. And we've still got one more suture to tie. You can see how we're getting our implant down. We're going to tuck that underneath in a minute. Okay, so the final suture we will pass anteriorly. We'll show you that in just a second. Crochet hook. Okay, so we're done. We've got everything tied. You can see crochet. Yeah, you can see how the implant is down here. And I'm happy with the way that looks, okay? As I rotate your shoulder, that looks pretty solid. Okay, so we're going to finish up here and get you back to the recovery room shortly. Bye-bye now.